مساء الخير جميعا. نحن اليوم في ويبينار عن الصحة العامة في العراق وعلاقة ذلك بالبيئة وذلك بالقطاع الصحي في العراق. وكما تعلمون أنه العراق واجه أو مر بحوالي 4 عقود من الحروب، وبالتالي هذه عدم الاستقرار السياسي والأمني في العراق أثر بشكل عميق وكبير على الصحة العامة وعلى مؤسسات الصحة العامة، وبالتالي هذا أثر على الخدمات المقدمة من قبل الدولة للمواطنين، مع اتساع فقاعة الصراعات داخل البلاد. وبالتالي أيضا هناك نقص كبير في التمويل الذي يواجه قطاع الصحة العامة مع بروز عوامل جديدة مثل الأمراض التي نشأت جراء استخدام الأسلحة المحرمة مثل اليورانيوم المنظم، أو إضافة إلى ذلك التغير المناخي الذي عصف بالبلاد خلال ال10 أعوام السابقة وما زال مستمرا. لذلك اليوم في هذه الجلسة سوف نناقش مع مجموعة من الخبراء العراقيين ممن عملوا ميدانيا على فهم على فهم القطاع الصحي وتأثيرات التي نقرأت على هذا القطاع على مدى 4 عقود، وهذه العقود تقسم ما بين ما قبل 2003 وما بعد 2003. وبالتالي كل هذه المراحل التاريخية التي مر بها العراق هي أثرت بشكل كبير على تقديم الخدمات الصحية للمواطنين. بالتالي اليوم لدينا 3 متحدثين أساسيين، هم عمر ديوجي، وهو أستاذ مشارك في الأنثروبولوجيا الطبية والصحية العالمية في جامعة روتشلد وجامعة نيوجيرسي. وعمر عمل على مدى عقود فيما يخص ما يخص الإضاءة على الحروب والعنف الدائر في العراق والشرق الأوسط، وساهم في تأسيس برنامج قطب الصراعات في الجامعة الأمريكية في بيروت، وكذلك قام بتدريس الطب الاجتماعي والصحة العالمية. أيضا عمر لديه مشروع مستمر، وهو مشروع بحث أنثروبولوجي يسلط الضوء فيه على تجربته الشخصية في القطاع الصحي، وكيف رصد ووثق مسارات وبيئات لإصابات الحروب والخدمات والخسارة، وإعادة تشكيل جغرافيات الرعاية الصحية والإنسانية في العراق والشرق الأوسط. طبعا عمر حصل على دكتوراه من جامعة بغداد، ولكنه درس أيضا حصل على ماجستير في الصحة العامة من الجامعة الأمريكية في بيروت، وأيضا درس الدكتوراه في الأنثروبولوجيا من جامعة هارفارد. وله مجموعة كبيرة من المنشورات التي تسلط الضوء على حوكمة القطاع الصحي في العراق تحديدا. وأيضا كتابه أيضا كان كتابه حياة غير قابلة للحكومة الطب الإلزامي وحكم الدولة في العراق، الذي نشرته جامعة ستانفورد عام 2017، فاز بجائزة الكتاب الألفية الجديدة لعام 2019 من جمعية الأنثروبولوجيا الطبية. أيضا معنا مات التن، وهو المدير التنفيذي لمعهد الدراسات الإقليمية والدولية في الجامعة الأمريكية في العراق في السليمانية، وهو أيضا زميل باحث في كلية في لندن. ومايك هو يعد عالما في الأنثروبولوجيا، وأجرى أعمالا ميدانية وقاد فرق بحثية في العراق ولبنان واليمن، وأدى عمله الأكاديمي إلى اكتشاف أو أدى عمله الأكاديمي إلى استكشاف التأثيرات الطويلة للصراع على الصحة العامة والبنية التحتية المرتبطة بقطاع الصحة الأولية في العراق والشرق الأوسط. أيضا معنا طيف الخضري، وهي طالبة دكتوراه في قسم السياسة والدراسات الدولية بجامعة كامبريدج، وأيضا مارست أدوار مختلفة في مركز الشرق الأوسط للدراسات الأسئي على مدى السنوات الثلاث الماضية، وأيضا ركزت في أبحاثها على الحركات الاجتماعية في العراق وإعلان حقوق المرأة، وركزت كثيرا على الاحتجاجات التي حدثت في العراق خلال السنوات الثلاث الماضية، بدءا من احتجاجات الأسرة عام 2018 ومرورا باحتجاجات العراق العامة في عام 2019 والمعروفة باحتجاجات تشرين. بالتالي اليوم سوف تكون لدينا مجموعة واسعة من المواضيع التي سوف يناقشها المتحدثون معنا، وأعتقد أنه من المنطقي البدء مع عمر بيوجي لاستعراض الكيفية التي أعاق الصراع الدائر في العراق على مدى عقود، وكيف أثر هذا الصراع على القدرة العامة وأداء النظام الرعاية الصحية، سواء الرعاية الصحية الأولية أو الثانوية أو الثالثية، لأنه قطاع الرعاية الصحية في العراق ينقسم إلى ثلاثة مستويات، وبالتالي عمر سوف يكون الأقدر على الإجابة وتحليل هذا النظام، وكيف أثر وكيف تأثر هذا النظام الصحي، وأيضا كيف وأيضا سوف يناقش كيفية استجابة هذا النظام للتحديات التي طرأت على المجتمع العراقي فيما يخص القطاع الصحي. نعم عمر.
شكرا صفاء. أنا طبعا أعتذر هتكلم باللغة الإنجليزية على مود نكون ثلاثتنا في نفس المجال. So welcome everyone, and thank you so much for the initiative for inviting us to focus on the nexus of environment and public health in Iraq. I think this topic is extremely important in both historically and in the present moment, as it really represents one of the major critical points in the kind of defining the present and the future of Iraq as a country, as a population, and also as a state. What I want to do first is to explore a little bit some of the historical processes that have undermined Iraq's healthcare and its ability to respond to environmental crises and epidemics. Now, ironically, one of the part of the work that I have done has been historical work, which is exploring how healthcare from the British mandate, from the British occupation of Iraq throughout the US occupation of Iraq, has been very central in the process of state making and unmaking. So if we kind of explore some of that history, and we see that medicine, public health, and health crises and environmental crises were very central to the kind of the problem of governing and authority in Iraq from the earlier years of the mandate throughout the kind of the collapse of the Baathist regime and the kind of the rise over the last 20 years of the kind of the most recent political system in Iraq. Now, what you see is throughout the kind of the 20th century is that healthcare that Iraq's promise was, the healthcare has been very central to Iraq's promise, what Iraq can offer to the region. It actually throughout the 1970s and even in the 80s, healthcare in Iraq was kind of on a fast pace in terms of the expansion of hospitals, even during the Iran-Iraq war. Actually, one of the most important monuments of that war was the building of the subspecialties hospital, the subspecialty surgical hospital, which was kind of meant to was inaugurated in the mid 1980s, and it was meant to address many issues like kind of war injuries, complex surgeries, and these were kind of part of the expansion also in medical training, despite the fact that the quality of that training was kind of fluctuating in the 1980s. What happens in Iraq really, the biggest blow to Iraq's healthcare happens in the 1990s with the destruction of Iraq's infrastructure, especially the electricity system, under the US-led campaign to liberate Kuwait, and really the kind of the trickle-down effect of the failure of electricity on all kinds of systems like sewage system, water sanitations, and of course the destruction of roads, communication, and all of that. So what we begin to see in the 1990s is a kind of a destruction of this entire infrastructure that supports any kind of public health and environmental kind of management. And then the other aspect of the infrastructure is the human infrastructure, is the exodus of Iraq's professionals, middle class, and of course doctors. And we see a kind of during the 1990s also the rise of corruption as a mode of survival in Iraq's healthcare, and of course across all aspects of social life and different kinds of institutions. 2003, many people, when they look at kind of what happens in Iraq, they begin with 2003. However, I was trying to kind of make as a point is that this process had already begun throughout the first Gulf War, the 91 campaign, and then of course the 12 years of economic sanctions. Over the last 20 years, Iraq deals with a major assault on its environment, on its public health system. This manifests through military activities in the country, the contamination that happens from all kinds of artillery, machinery used, fuel, and of course the destruction of the urban environment, the destruction of the chaos that emerges in the post 2003 begins to determine many problems and determine a kind of a chaotic period in Iraq where there is a rapid urbanization, a massive population growth, immigration from the other governorates into the capital, the city right now. I mean, in the 90s, Baghdad probably was around maybe 5 million. Now, currently, Baghdad is around 9 million person living in the city, and that you can see that right now over the past 2 years, there has been a major urban renewal in the city, and that has brought in Baghdad is entirely like a big workshop. There are new roads, the homes have been destroyed. Wherever you go in Baghdad, you see this kind of chaotic destructions of homes and rebuildings of smaller places to accommodate this kind of growth in population and to deal with the congestions brought in from the unregulated cars imports, or from the kind of the overpopulation in the cities. So literally, when you talk to any healthcare professional in Iraq, they will tell you that actually since the 1980s, there hasn't been any major public hospital projects in Iraq or across Iraq. There have been this kind of fragmentation of the public health or the healthcare system. You see a kind of a rise of an unregulated private sector. You see kind of the rise of these alternative entities across the country that deals with healthcare. So I think kind of to kind of wrap up here, because I know my time probably is going to be out soon. I think what you begin to see, what really the kind of the major points here is that this kind of long-term war has impacted the infrastructure in Iraq. And by infrastructure here, I mean the kind of the physical infrastructure and the kind of the human infrastructure. Many people kind of got displaced, many professionals left, and that kind of impacted the level of professional work and scientific work within Iraqi institutions. And I guess I can kind of comment a little bit more on some of the more specific problems that had emerged in Iraq over the past decades in the second round. So thank you so much.
نعم عمر، شكرا جزيلا. أنا فقط نسيت أن أنوه لدينا ترجمة فورية من الإنجليزية إلى العربية، وبالعكس لمن يودون سماع متحدثين بالعربية أو سماعهم من الأصوات الأصلية باللغة الإنجليزية. الآن أنا من أجل استكمال ما بدأه عمر حول أن بني القطاع الصحي وكيف هو وانحدر في العراق خلال العقود المؤمن السابقة بسبب الحروب. أنتقل السؤال إلى مارك إنتن حول لاستكمال ما قاله عمر. بالتالي كيف يمكن فهم الروابط ما بين النظام الرعاية الصحية طبعا الحكومية والمجموعة الأوسع من المؤسسات الحكومية والجهات ذات العلاقة في دار القطاع الصحي، وكيف يمكن، وهل هناك نوع من الحوكمة أو المساءلة أو نوع من الرقابة الصحية أو نوع من متابعة الوضع الصحي في العراق من قبل المجموعة الأوسع من الوزارات مثل وزارة البيئة، وزارة الموارد المائية وإلى آخره، مع الإشارة بأن وزارة البيئة كانت جزءا من وزارة الصحة على مدى عقود طويلة، وبالتالي النظام السياسي لم يكن مهتما كثيرا بموضوع الصحة، موضوع البيئة وعلاقتها بالصحة العامة، وبالتالي خضع هذا المعيار في مأسسة القطاع الصحي للمجال السياسي سواء ما قبل 2003 وما بعد 2003. بالتالي كيف يمكن أن نفهم أن الإهمال الجسيم الذي قامت به الدولة العراقية لقطاع الصحة وقطاع البيئة في ظل انتشار الملوثات، في ظل الآثار الجسيمة للحروب على المجتمع العراقي؟ نعم مارك.
Thank you, Safa. Indeed, there is a kind of broader network of institutions that are involved not only in environmental management, but also in public health. So you have, of course, the Ministry of Health, but then you also have, a number of other entities that, in theory, should be brought into this process. Ministry of Environment in Iraq deals with environmental regulation and sort of monitoring violations. So for instance, if there's some kind of oil spill that gets into Shatt al-Arab, Ministry of Environment should be the one that tracks that violation, writes citations, and holds people accountable in concert with the relevant sort of local authorities. You have Ministry of Municipalities, which is responsible for purifying the water at the local level, and for monitoring kind of the levels of chlorine and all that kind of stuff that's required to make sure that you have drinkable water. And you have provincial governments, local governments, that should be sort of the connection between these kind of monitoring agencies and the local populations, to advise them when there are environmental threats that might impinge on their health. And then, of course, the Ministry of Health itself is kind of at the nexus of all of these institutions. One kind of broad thing to say about, okay, why is there a kind of, why in general in Iraq is there a kind of weakness across this network of institutions, is that they've just been systematically underfunded. So at some level, it does come down to money. After 2003, there was really almost no substantial budgetary allocation to these entities. And meanwhile, the sort of security apparatus ballooned, and the kind of securitization of the government absorbed a lot of the state resources. Another factor, though, that I think is a bit more interesting is just the question of sort of intergovernmental connectivity. Public health responses are very complex, and they require data sharing, They require shared projects between different ministries, which of course requires sharing money and requires sharing information. And one of the impacts of conflict in Iraq has been that each sort of government entity has been politicized, not in a simplistic way. It's too simple to say that each political party owns a ministry. I know that we often have that mindset for Iraq, this sort of muhassasa. There is a muhassasa, but it's a bit more chaotic than that. But there is a sense in which politicization of these government agencies impedes the kind of data sharing and finance sharing that you need for effective responses. So just to make this a bit concrete, if you think of what happened in Basra in 2018, the provincial water department's laboratories were generating readings, about these levels of pollutant. The readings were faulty, but they did have some idea, but they failed to communicate these warning signs with the health and authorities, who then in turn failed to communicate with local governments to alert and advise the population on ways to deal with this contaminated water. So this issue of sort of cross-governmental connectivity and how conflict has sort of undermined this is an important thing to think through. One last layer here, which I think is important to underscore, is that we're not just talking about, when we're thinking about public health, we really have to have a pretty wide lens. It's not just government actors that are narrowly involved with let's say, human health or environmental pollution. You also have to think of this broader kind of interspecies aspect of human, plant, animal health, because of course, human and animal health are interconnected. And some scholars and health practitioners, use this concept of One Health, which is a term that's kind of been popularized in global public health circles over the last decade, out of a recognition that infectious diseases and pathogens spread due to, this complex and changing interaction between humans, plants, and animals. And, that might sound complicated, but really all it means is that when animals and plants are impacted by disease, this impacts humans too. And in Iraq, you really can't avoid this, especially with all of these waterborne illnesses and water scarcity issues. Every week, there's a new story about how water pollution and water scarcity are producing mass fish die-offs, water buffalo deaths, and intestinal ailments for humans all at once, right? And so, when we think about the government context for this, you would need there to be coordination between, let's say, the veterinary department within the Ministry of Agriculture, which probably has the best sense of what's happening with the water buffaloes and the fisheries, and they need to be communicating with the Ministry of Health. But again, in a kind of context in which these state institutions have been so shaped by, as Omar was saying, the sanctions, the kind of political and social chaos of the post-2003 scenario, that kind of connectivity really breaks down.
سؤال معك طبعا مؤتمر فقط هو للإشارة بأن وزارة الصحة في العراق لا تحصل إلا على أقل من 5 مليار دولار سنويا من الموازنة العامة، وهو ما يؤثر بأقل أو حوالي 1% فقط من الموازنة العامة، وبالتالي لا يمكن وبالتالي هذا في حين أن سوق الصحة العامة في العراق يتراوح ما بين 10 مليار دولار إلى 15 مليار دولار، لكن التمويل الحكومي هو أقل بكثير مما يجب أن يمول به القطاع الصحي. وبالتالي وخصوصا في جنوب العراق، لأن لدينا الكثير من المشكلات الصحية في جنوب العراق، مثلا الاستخراج النفطي غير النظيف، حرق الغاز المستمر، وبالتالي وأيضا توسع رقعة الاستثمارات النفطية، وهذا ما سوف نتحدث به قريب فيما يخص كيف للاستثمارات النفطية في جنوب العراق والحرق الغاز المستمر أن يؤثر على الصحة العامة في ظل عدم وجود إطلاع رعاية أو إطلاع صحي مؤهل للتعامل مع المشكلة البيئية الناتجة عن استخراج النفط في جنوب العراق. نعم طيب.
Thanks, Safa. So I'm going to talk about gas flaring in southern Iraq as part of my first intervention. And I think that this issue is something that has recently begun to garner attention, particularly in Europe, but actually has a really long history in Iraq. And what sort of surprised me when I first started working on this and speaking to people about it is that everyone knows. In Basra, everywhere I went, everyone knew, because it's those people who are getting sick. It's their families, it's their sons, it's their daughters. So it's very apparent in Iraq, even if it might not be apparent to the international community. And some communities sort of told me that actually this issue was already prevalent or noticeable already in the 1970s. But people were too afraid to speak out about it then. And the earliest kind of reference that I found to gas flaring in southern Iraq in particular was in the early 1950s. So it's very much an ongoing issue that different governments during different periods have tried to control, but that everyone sort of agrees that after 2009 and with the return of the international oil companies very much went up as the amount of oil being extracted went up. And while there is this plan by the Ministry of Environment to curb gas flaring by 2028, in fact, what's happening in places like Basra is the amount of gas being flared and the amount of flares in Basra is going up, with some people saying that there's something like 700 flares at the moment because the government continues to sell off oil fields and to expand its oil operations. And why sort of this issue is currently well, I want to talk a little bit about why this issue is currently kind of difficult to tackle in Iraq. First of all, in the licensing contracts that the Iraqi government sort of signed along with the international companies after 2009, oil and gas are separate entities. So the oil companies get money for extracting oil, but the gas the associated gas that burns when they extract the oil is supposed to be handed over to the Iraqi government. So they're disincentivized because they don't actually make any money from the oil that's extracted. And two, the environmental provisions in those contracts are really vague. So it says something like those companies need to prevent environmental harm to the greatest extent possible. So what that does is it puts the onus on the companies to decide and to argue for how to interpret that clause. What is the greatest extent possible? And while there's currently a consortium of private companies and the Basra gas company to utilize the gas being flared, this is not happening at the moment because in order for them to install the kind of infrastructure that would enable them to do this, production would have to be limited or stopped. And obviously no one in the Iraqi government or from the sort of international side wants that because it impacts their profits. In terms of why this has become a public health issue, one is because the burning of gas releases pollutants, which has caused respiratory problems and also cancers. And often these sort of fields are expanding into spaces where people are already living, or in the case of Basra, the government is currently giving out lots of plots of land that basically expand out towards the oil fields. So this is happening in really heavily populated areas. There are cases in which people don't want to leave. For example, in the case of some residents of the marshes, because this is their ancestral sort of home, And there are cases in which people aren't leaving because the government will not compensate people because of the issue of informal housing, which basically means that if they compensate people and move people living close to the oil fields, then you have this other sort of massive informal sort of dwellings that the government would then also need to compensate and move. And as sort of Mac and Omar also spoke about, when people are getting sick, there is no adequate public healthcare infrastructure, which means that people are traveling really long distances for private healthcare, and a lot of people can't afford it. They can't afford the journey, they can't afford the medical fees. And there are also lots of issues around accountability for this. So one, the question of cancer cases is considered to be a really contentious issue among the sort of Iraqi government and its various entities. So at present, there isn't sort of an official number of how many cases there are. I got a figure of 9,000 from the Human Rights Office in Basra, and then a different lower figure per year from the local environmental office there. And it means that when people raise these issues, they face all sorts of reprisals. So there are people who've been kidnapped, there are people who've had legal cases against them, there are people sort of doing citizen science who've like tested the pollution in areas that the government has tested and found different results, and their equipment has been like stolen. So like drive by, someone came on a motorbike and they snatched their bag that had that equipment and data on it. So there's all sorts of issues around accountability. And also, as Mac was saying, there's no data. So people can't sort of go to the companies or go to the government and be like, this is why this is happening, and we want compensation, or we want you to do something different, because there is no sort of accurate data to say, to sort of draw a link between, let's say, gas flaring and cancer, like within Iraq. And a lot of people who I spoke to, for example, kept talking about uranium, the historical use of uranium during the various wars since the 1980s, and the extent to which that contributed to the current spike in cancer rates. So there's a lot of confusion in relation to this as well from what I saw. And I'll leave it there. Thank you very much.
شكرا جزيلا أيض. طبعا في الحقيقة الوضع في جنوب العراق وفي البصرة تحديدا معقد للغاية، لأن بالتالي لدينا مجموعة مصالح متقاطعة مع بعضها البعض، مصالح حكومية مع مصالح الشركات مع مصالح العشائر مع مصالح المجتمع المحلي. بالنتيجة جميع هذه المصالح هي تؤدي إلى مزيد من الإنتاج، مزيد من الملوثات، وبالتالي أنتقل إلى عمر بالسؤال حول بالتالي العراق ربما قبل الطفرة النفطية، قبل اكتشاف النفط، أو ربما أو ما قبل 2003 مع الزيادة الهائلة في الإنتاج النفطي، وأيضا مع بروز ملوثات كبيرة في مناطق مختلفة من العراق، كيف يمكن تقييم الوضع الصحي حاليا في العراق مع وجود أمراض جديدة، أمراض مختلفة عما هو معروف من أمراض متوطنة في العراق؟ وبالتالي كيف يمكن أن يؤثر اتساع جغرافيا الأمراض في العراق، كيف يمكن أن يؤثر على استجابة النظام الصحي الحكومي؟ وهل هناك نظام صحي بديل يمكن أن يعوض غياب القطاع الصحي الحكومي، أم أن المسألة آخذة من اتجاه نحو الفوضى الصحية؟ نعم عمر.
Sorry, I was muted. Thank you, Safa. I'll actually kind of answer this through a kind of an example, and this example has to do with the kind of some of the work that I've been doing over the past, I would say, maybe a decade. So one of the interesting things that happened when the U.S. occupied Iraq is that a lot of the U.S. soldiers became infected, or they're kind of the injured soldiers became infected with these these superbugs that were very difficult to treat. One specific bacteria was called Acinetobacter baumannii that actually the U.S. military called it Iraqi bacter. So the question was this bacteria really kind of emerged with the U.S. occupation? Was it kind of a byproduct of the war, of the contamination of the environment, of the collapse of the healthcare system, or was it something that was kind of brewing during the sanctions in Iraq and was kind of not really on the radar of the local doctors or the local practitioners? I mean, I myself was a physician. I worked in Iraq in the 1990s. I've never heard of this bacteria before. We never kind of encountered any of that. But also, that being said, I also was not someone, and as like many of my colleagues, we were not trustful. We did not trust the laboratory system that had kind of already collapsed around us. So a lot of our judgment is based on clinical judgment and on kind of bedside assessments and things like that. So the U.S. kind of brings in this problem, and it kind of moves with the U.S. soldiers in Iraq. But what the interesting part is that the U.S. military and the U.S. doctors would never even kind of say, this might be a big problem in the Iraq healthcare system. How can we help? That doesn't really happen, and for almost like a decade, and until probably 2016, this problem continues to be under the radar. Iraqi physicians are operating on patients. Some of them are war injuries. Some of them are regular surgeries. Their wounds don't heal very easily. There is a big problem. Infection comes out. Iraqi patients lose trust in the Iraqi healthcare system. As Taif was saying, they begin to kind of try to either go to the private healthcare sector, or as Mac and I have shown also, they've traveled to Beirut, they traveled to Syria back then, they traveled to Iran, to India, because there was something wrong with the Iraqi healthcare system. People go to the hospital, they come out of it much sicker. So this problem continue to be under the radar for almost a decade. There were no kind of interest in exploring this. We get a sense of this problem every time there is a kind of an international organization doing some kind of a microbiological assessment. MSF goes to Mosul during the war and begins to report these incredible levels of antimicrobial resistance in the Iraqi patients injured in the war. The MSF in Amman receiving patients from Iraq, injured Iraqis during the Harb al-Ta'ifiyya, during the civil war. They begin to report these incredible high numbers in Iraqis. Doctors in Beirut, they begin also to see that Iraqi patients were having these higher rates of these antimicrobial resistance that is uncomparable even with patients coming from the Syrian war or from the Libya. But there was definitely something clear that both the public healthcare system and the environment where many people are being injured is definitely driving, at least a speculative kind of a way of thinking about it, that it was driving this problem that is undermining healthcare even more than its current situation. So in this last visit that I went to Iraq, I was kind of interested to know what is going on in Iraqi hospitals. What is the status of understanding antimicrobial resistance? And until 2019, and this is kind of a pessimist story. We say in Arabic قصة متشائلة، يعني بين المتشائمة والمتفائلة يعني. So this pessimist story going on. So in 2019, the WHO and the Ministry of Health decide in creating a unit to begin to identify and report and do this kind of ongoing surveillance of antimicrobial resistance. And surprisingly, a lot of this data, and I've just realized this, that it's being reported weekly and updated on the WHO websites for antimicrobial resistance. And when you look at the Iraq data, you realize that this is a major, major, major problem. So comparing the presence of this Acinetobacter in Iraq and let's say in Egypt, like you see 9 cases over the past, I say 10 years have been reported in Egypt, while in Iraq, it's a prevalent problem. It's about 55% prevalent in neonatal wards, in where these newborns are kept. And actually, one of the visits that I did was looking at these neonatal wards and these premature babies, and every week these incubators, the space, one of the kids is definitely having an AMR problem. We saw a few kids, and they're being kind of bombarded with these really, really heavy antibiotics that are usually kept on for last minute. So there is a kind of a double sword story here. Now this problem is more visible. For over these 20 years, this problem has become completely invisible because Iraq did not necessarily have the laboratory capacity to visualize, or at least to detect, the kind of right antibiotics to use on the right kind of bacteria. So people have been using antibiotics in a completely haphazard way. So right now we can actually see the problem, and it is a major crisis. It's a problem, as Max said, it's not just a kind of a human problem. It's a problem that will affect a kind of a planetary health level. The crisis in antimicrobial resistance is a global planetary health crisis that kind of promises to end really the antibiotic era and return to this really dark period of failure of infection control. But on the other hand, what you see is this beginning of a new system of surveillance. People are trying to figure out now how to use antibiotic in a proper way, at least more in the public sector in Iraq. Now, the biggest problem when you ask doctors in the public sector, what do you think is the fear? What do you think the problem? They say, well, we are now trying to control this in the public sector, but I have no control over the private sector. Iraq's last 2 decades has seen an explosion of private pharmacies, private clinics, a kind of a drive to overprescribe medication, including antibiotics. You can get, I mean, one of the most kind of preserved antibiotics is imipenem, which is used only in hospitals and used in IV. You can purchase that in a pharmacy in Iraq. So it's a little bit of a kind of an antibiotic anarchy, if I can use that term. But there is definitely a need for regulating, as the beginning now of a regulation of and surveillance of the public sector. There needs to be a much stronger regulation on the private sector, a kind of a control over prescription, a control on this relationship between the doctor and the pharmacist, that really will be defining the kind of the future of healing and wound care and infections and newborns. And these are all issues that are not just about the healthcare system itself, because the use of antibiotics in the environment, the waste that comes out of hospitals, these are non-treated, and these are all being thrown in the Tigris River. So this problem has a vicious cycle that will move from the healthcare to the community, from the community to the healthcare. And in fact, it kind of blurs that line between what is a kind of a hospital-based infection and what is a community-based infection.
نعم، جزيلا عمر. طبعا من الأكيد من الحقيقة أنه العراق مر بتحولات وبائية خطيرة عن العقود الماضية، ومنها انتشار أنواع كثيرة من السرطان. هذه أنواع تختلف من مكان إلى آخر. يعني هناك أنواع من السرطان تنتشر في جنوب العراق بسبب استخدام أنواع معينة من الأسلحة أو بسبب الملوثات الناتجة عن استخراج النفط والغاز. لكن لو اتجهنا شمالا مثلا في محافظة ديالى، سوف نجد أن هناك أنواع من السرطانات تلحق هنا استخدام استخدام حمايات الاتصال الغير محمية أو غير قانونية، على الرغم من أن هذه الحمايات هي مرخصة من قبل الدولة، لكن هذه الحمايات هي ليس فيها أي نوع من الحماية للسكان. كذلك أيضا لو اتجهنا شمال أكثر نحو الموصل سوف نجد أن هناك انتشار معين للسرطانات. لكن هناك مفارقة تاريخية. ما قبل 2003 كان النظام العراقي السابق يحول موضوع السرطان إلى موضوع سياسية، بالنتيجة لأنه كان يحاول إظهار العقوبات الدولية على أنها عقوبات تؤثر على الصحة العامة. لكن ما بعد 2003 الحكومة العراقية أو النظام السياسي العراقي يحاول إخفاء انتشار هذه السرطانات، على الرغم من وجود هناك مجلس في وزارة الصحة تحت عنوان مجلس السرطان العراقي، لكن لم تصدر أي إحصائية من هذا المجلس حتى الآن. بالتالي السؤال إلى ما يتناول موضوع انتشار السرطان في العراق في كثير من أعماله. بالتالي كيف يمكن فهم جغرافيا السرطان في داخل العراق، وكيف يمكن فهم أو إيجاد روابط ما بين التدهور البيئي وما بين مخلفات الحروب وما بين ارتفاع معدلات السرطان في جميع أنحاء العراق، بغض النظر عن الجغرافيا. بالتالي لدينا مساحة، لدينا جغرافيا واسعة من الناس المصابين بأنواع مختلفة من السرطانات. كيف يمكن أن نفهم ذلك في سياق الانهيار البيئي وفي سياق مخلفات الحروب؟ نعم.
Thanks, Safa. And really, you've already laid out a lot of the complexity that's at place here. There's no one single story about cancer in Iraq. Different regions have different ways of looking at the disease, as you noted. I think some of the questions around what kinds of cancers are associated with which regions and which toxins really still need a lot of research. This is more, frankly, at the more sort of clinical and anecdotal level that we have these distinctions, rather than at the truly substantiated level. But let's take this back a bit. I think a historical perspective is important here. As you mentioned, Safa, there's kind of this irony in terms of the pre-2003 politicization of cancer and the post-2003 I think you could call it an attempt to depoliticize cancer by ignoring it. Prior to 2003, right after the Gulf War, the Ministry of Health at the time invested a lot of energy and effort, both at the level of data collection, but also at the level of, you could call propaganda, to consolidate a story of cancer around one single toxic substance, which was depleted uranium, right? And the narrative around this was that the US had used depleted uranium munitions during the Gulf War, and that the high concentration of that depleted uranium, particularly in some of the southern areas, had led to certain kinds of cancers having an uptick. And of course, there was even at that time in the mid to late 90s, there was a pretty complicated evidentiary politics that emerged, where the Iraqi government had their claims, the US government had their counterclaims, and it sort of went back and forth with one side trying to shed light on this problem, and the other denying it. I don't really have enough time to get into sort of the nuances of that debate, but one thing that's definitely true is that after 2003, the new government actors that emerged and the new Ministry of Health, the post-2003 Ministry of Health, was not interested in cancer. There was no commitment to this sort of narrative of war-related environmental pollution and its impact on cancer. Yes, there were these kind of committees that emerged that you mentioned, Safa, but they were not invested in a kind of, claim making when it comes to cancer incidents. And when I started doing my research on this topic about a decade ago and spent time, with Iraqi cancer patients, one of the things that I noticed very quickly, and I'm sure Omar also noticed this in his, dialogue with cancer patients, and Taif has alluded to this as well in her recent work, is that Iraqi cancer patients were not uniquely invested in depleted uranium. They had a very broad and fragmented toxic landscape that they were making sense of, And this really didn't matter what region you're talking about, whether you're talking to somebody from Basra or you're talking to somebody in Mosul. Generally speaking, there was a sense that there was this is a country that had gone through a number of different wars, and not only that, there are a number of different actors involved in these wars, each with their own kind of culpability in relation to war-related toxicity. And on top of that, you had the kind of story around collapse of governance and the lack of environmental regulation, gas flaring, and agricultural pollution, any number of other pollutants that sort of create what you could say is kind of like a toxic soup that is so varied and so layered that it becomes, as I thought Taif's wording was perfect, it's confusing. It isn't something that at the level of the patient or the doctor that is knowable in a kind of quantified sense that we like to reside in. So I think that one of the difficulties here, and I'll just sum it up with this, that you have a kind of challenge when it comes to data. Cancer, as Taif mentioned, in order to kind of track its incidence levels, you need baseline, you need to know where you're starting. And then you also need some kind of sense of how patients are moving. So when you have a lot of patients that are both moving within Iraq, both geographically and institutionally, they might start in the public sector, then go to the private sector, or start in the private sector, go to the public sector, then they might go across borders. It's hard to know how many patients actually even have cancer, right? And then you also have just the problem of care. So war not only generates these toxins and creates these potential associations with cancer incidents, it also has eroded the capacity of the state to care for cancer patients. And so this question of, are we dealing with a big disease burden because of environmental pollutants, or are we dealing with a big disease burden because of the evisceration of care and the fragmentation of care? These two questions really are tightly entangled with each other. So that's to sum up. I think really, if we're thinking about cancer in Iraq or any of these kind of complex diseases, we need to have mixed methods, multidisciplinary teams that can look at these questions from different angles, because there's really no one simple data point that you can settle on that can give you a clear answer.
شكرا جزيلا مات. نعم، بالفعل بالنتيجة لدينا نقص هائل في العيادات، ولدينا نقص هائل فيهم حالة الإصابة بالأمراض والسرطانات في العراق. وبالتالي وزارة الصحة لا توفر مثل هذه المعلومات والبيانات للرأي العام، باعتبارها ربما جزء من الأمن القومي الصحي العراقي. وبالتالي لا يمكن أن نطلق حالة هذه الإصابات، وهذا ما سيقودنا للتساؤل عن في ظل وجود هذه المشكلات الصحية والبيئية في العراق، وبالتالي في ظل وجود إهمال حكومي ونمت القطاع الصحي وانهيار البنية الصحية، إذا ربما لابد من وجود مقاومة بيئية من طرف المجتمع المحلي أو من طرف المجتمعات المتضررة جراء إنتاج النفط أو جراء الملوثات أو جراء مخلفات الحروب. وبالتالي هل هناك، والسؤال إنه طيب، هل هناك من مقاومة على أساس بيئي في العراق؟ هل أن المجتمع المحلي بدأ أن ينظم نفسه من أجل المطالبة بحقوق بيئية أو من أجل تحسين الصحة العامة أو منع استمرار انهيار القطاع الصحي والقطاع البيئي؟ نعم طيب.
شكرا صفاء. Just before يعني I speak about the kind of protests and uprisings and things like this, I wanted to comment on the data question as well, because Safa, you're right that the government and the Ministry of Health, it doesn't give any data out, and this is one of the big issues. But researchers also have issues because private companies, so like in the oil fields, for example, they don't want them testing the pollution. So in order to get data, they like have to secretly put like equipment in certain places. Or like I spoke to someone who literally had to like jump a fence to get like a sort of soil sample. So there are just so many obstacles to actually getting like accurate information that you can then use to make a claim or to like, I don't know, fix an issue. Anyway, in terms of protest or a kind of environmental movement in Iraq, I think that often we tend to focus on big instances of protest or uprisings, but also there are everyday protests that we see, for example, in the south and in Basra in particular. So quite often there are protests, for example, outside of the oil fields, and those protests manifest themselves as employment protests. So people want jobs, but there's also an environmental aspect to those protests insofar as, sorry, I had to hide myself, it's too distracting. Insofar as people also think that they're entitled to jobs in the fields or within these specific extractive industries because they are the people who are impacted most by the pollution, including from a public health perspective. And what you have now with some sort of NGOs and activist group that I spoke to is this idea that they're trying to use unemployment or this right to employment as part of their conceptualization of environmental justice, which is something that we see in other contexts as well. And when these protests take place, people also have other demands, and often those demands are for services and for adequate infrastructure. So, for example, in Medina, which is this sort of big town in the middle of two oil fields in the province of Basra, in 2014, there were really big protests. And again, they manifest themselves first and foremost as protests for jobs, but actually people were also demanding health infrastructure. So at that time, what people won or what they were promised was 7 ambulances, many of which have not materialized. And they also wanted extra beds and equipment in the hospital. And I heard that there's like a new floor in the, there's like an additional floor that's been built in the hospital that's close by to the town. But like what we see again is how people are really demanding the bare minimum due to the destruction of the health infrastructure in Iraq that we've sort of talked about and that has happened over a long period of time. And obviously environmental issues also manifest themselves in these sort of extraordinary instances of mass protest. And the most sort of famous or well-known that Mac also picked up on are the 2018 protests, which saw over 118,000 people end up in hospital due to the rise of pollution levels in the water. And what I've recently learned is that because Basra is the lowest downstream point in Iraq, all the sewage, all the rubbish, all the medical waste that's thrown in the rivers ends up accumulating in Basra. And that's why their water is so polluted and so bad. And what happens in 2018 is that the water levels also go down, which means the pollution goes up, and so does the saltiness, the salinity of the water. And so people are cooking from this water, they're showering with this water, but also they're drinking water from the same source, because what's happened is that there are private companies who basically take water from the same source and they clean it up. They what's the word? Sanitize it, I guess. And so because at that time, the levels of pollution were so high, they didn't put enough stuff in the water to clean it up. So even the drinking water was making people sick. And it's out of these 2018 protests, which basically led to the fall of the local government in Basra for a few days, and where this slogan, "We want a country first," emerged. It's on this basis that the 2019 mass protests were built. And part of what was happening in 2019 was people were speaking out against the corruption of the government, and with that, the lack of adequate public infrastructure like hospitals, like a functioning Ministry of Health. And they were also sort of protesting against the squandering of oil wealth, and also the fact that there was like no vision for a sustainable future in which these young people who were sort of protesting were figured. So yeah, I'll stop there.
شكرا جزيلا. طيب انا قبل ان افتح المجال لاسئله المتابعين والجمهور، انا فقط من اي سؤال سريع لعمر ايوجي. كما نعرف عمر، خلال الايام الثلاث الماضيه كان لدينا انتفاضه او احتجاج محلي واسع في جنوب او في شمال محافظه الديوانيه. هناك منطقه اسمها غماس. الناس منذ 3 أيام يتظاهرون، أضغطوا الحكومة المحلية في هذه المنطقة، أضعوا الشوارع. هم يتظاهرون من أجل الحصول على مستشفى وزيادة مراكز الصحة الأولية. وبالتالي هذا مثال واضح حول المقاومة البيئية أو المقاومة الصحية أو المطالبات من المجتمع المحلي. بالتالي هل تعتقد بأن الدولة العراقية تتعمد الانسحاب من القطاع الصحي لإفتاح المجال أمام قطاع صحي بديل تقوده جهات دينية أو سياسية؟
Thank you for this question. Yes, I mean, this is an interesting question. I think the biggest issue right now is that the healthcare sector is a major money-making sector. You know, you can see it with how the Iraqi government used to send Iraqi patients to Beirut and skim money for the Lebanese doctors and for the Iraqi doctors. You can see it in the way, let's say, a doctor working in the public sector would immediately kind of refer the patients all back to the private sector so they can actually charge them more money. The healthcare sector in general and the kind of the money that you can generate from is incredible. And I think one hypothesis would be, yes, there might be a kind of a withdrawal of the government to allow, I don't know, maybe the marja'iyya healthcare sector to take over. But I feel like the biggest kind of issue with with healthcare is that it is like everything in Iraq. It is when you see a kind of a dollar sign over that sector, then there are people who are going to really invest in capitalizing on this and figuring out a way to make money out of this, out of the suffering of others. So what we have seen in the last 20 years also is a certain kind of concentration of investment of government and non-government entities into different cities in Iraq. So you can definitely see Baghdad as somewhere where there's like kind of this attempt to improve the public hospitals, the Madinat al-Tabb, all these different hospitals. There are kind of plans to build new hospitals. But you see that also in the boom of the private sector, which has, you know, I mean, when I lived in Iraq in the 90s, it was Sa'doun Street, for example. That was where kind of the main kind of private sector, or Shar al-Rashid, you know, these were kind of, now it's all in Harfiya and Shar al-Kindi. These are, there is a there, every 2 meters there's a pharmacy, and I don't think there's a need for so many pharmacies in a place like that. So I feel like the biggest problem, as you know, many have shown, that the kind of the way that corruption drives these major interventions is really phenomenal. And I don't think healthcare is far away from that. In fact, I as I understand it, is that doctors and these people working in the healthcare sector, the health professionals, have benefited a lot from this chaos that has, many of them have made fortunes and big money out of this chaotic, irregular healthcare. So yeah, I'm not surprised if the government is waiting for a kind of an investment, a private investment in this, and of course that all means skimming money to channel through these kind of corruption networks.
شكرا جزيلا عمر. أنا فقط هنا سؤال من أحد الجمهور، يعني من أحد لا يشاء ذكر اسمه، لكن سؤاله وسؤالي ربما هو يعني يشتركان في بعض النقاط، والسؤال إلى بعض. بالتالي كيف يمكن السيطرة وإدارة ملف الصحة العامة في العراق في ظل فساد واسع النطاق، وعدم قدرة حتى وزراء الصحة في العراق السيطرة على الفساد المنتشر داخل المؤسسة الصحية العراقية؟ ويمكن أن نشير إلى استقالة وزير الصحة على العنوان في عام 2019 ورسالته الشهيرة إلى رئيس الوزراء آنذاك عادل عبد المهدي، وقوله أنه لا يستطيع مقاومة قوى الفساد ومراكز النفوذ والفساد داخل الوزارة، وبالتالي هو لا يمكن إصلاح هذا القطاع. بالتالي كيف يمكن فهم مستقبل القطاع الصحي العراقي في ظل غياب الحوكمة ومكافحة الفساد؟
I'll start with one reflection. You know, there have been attempts at quote unquote reform. There was a minister a few years back named Ala Alwan, who had this initiative, which I think overall was quite well-meaning, where he basically tried to advocate for the fact that you know, the kind of the most basic, you know, required pharmaceuticals that are needed at any hospital. At the time when he started his time in the ministry, was at about, you know, 11% availability. So, you know, the Ministry of Health publishes medications that are supposed to be always available. And he was going around to the parliament and to the Ministry of Finance saying, look, we're only at 11%. This is a catastrophe. We need a greater allocation from Parliament and the Ministry of Finance in order to get us closer to at least 50%. He, you know, really put in a lot of effort, and you know, he had formerly been at the WHO, and he got a lot of international actors behind this sort of effort, and successfully convinced Parliament and the Ministry of Finance to increase that allocation. And quite soon after that, the you know, the kind of percentage deficit really went down quite a lot. I think in about 1 year they went from 11% to 50 or 60%. Who knows if these statistics are exactly right, but you know, at least that's what was published. Minister Alwan did not last very long in office. Within months of that decision, he was basically forced out of his post. The irony here is that though he had brought more money into the healthcare sector, which you would think would benefit whichever political party or parties control the healthcare ministry, he insisted that that money, that greater allocation, come in with strings attached to it. That it needs, the pharmaceuticals need to be bought according to a certain schedule. We can't sort of chaotically buy, super expensive chemotherapy agents, whereas we don't have the most basic antibiotics, And this kind of distribution across this redistribution was more harmful to the interests, that are there, rather than, let's say, just thinking about the total amount of money, right? Because when we think about, like Omar was mentioning, money and its relation to these questions around private and public, one way for the healthcare sector to generate money is from the patients themselves. That motivates, the sort of push towards privatization. Another way is through, the sort of standard supply chain dynamics and procurement. So Qayyarah, which is a public company which imports medications and distributes them, there are certain political parties that have vested interests there. And for them, it's more important to protect those vested interests, which may mean getting really expensive drugs, that aren't necessarily needed, than it is to, let's say, think in a holistic sense about, pharmaceutical provision. So I would say the question of reform is that, yes, there have been examples of certain government actors who've come in responding to public pressure to make attempts to kind of slice into this sort of endemic corruption, but it's really hard. There's not that too many high-ranking officials within the ministry or ministers who have attempted similar things, because there's usually consequences to it.
شكرا جزيلا معك على هذه المداخلة. لدينا سؤال من أحد من أحد الجمهور، وهو مصطفى هاشم من هو الحويزة، أي أنه أحد المواطنين العراقيين الذين يتعرضون يوميا إلى الملوثات الغازية والنفطية، لأنه هو يعيش من حق الحكاية النفطي في محافظة ميثان، والذي تديره شركة بتروشاينا الصينية، أيضا بالتحالف مع شركة صينية أخرى سينوك. هذه الشركة تقوم بإجبار السكان المحليين على بيع أراضيهم. بالتالي لدينا في العراق قانون رقم 83 من سنة 1981 الذي هو قانون حماية الثروة الوطنية في العراق. هذا القانون يتيح للدولة العراقية تملك أي أراضي من النشاط النفطي باعتبارها محرمات نفطية، وبالتالي يمكن تعويضها أو لا يمكن تعويضها، هذا على حسب مزاج النظام السياسي. بالنتيجة لدينا عشائر وقرى في محافظة ميثان في البصرة يطالبون بالتعويضات عن أراضيهم التي تم سلبها من قبل الشركات النفطية. وأيضا السؤال هو لطيف، هل يمكن محاسبة أو ملاحقة شركات النفط العالمية العاملة في الحقول العراقية من قبل المواطنين المتضررين، سواء ممن سلبت أراضيهم أو ممن تعرضوا أو أصيبوا بالسرطان؟ ولدينا شاهد الشاب العراقي علي جلود الذي توفي بسبب السرطان في حقل الرميلة الجنوبي الشمالي في شمال البصرة، ووالده الآن يطالب بملاحقة شركة بتروليوم النفطية بسبب وفاة ابنه. بالتالي هل هناك إطار قانوني في العراق يتيح للمواطن العراقي محاكمة أو ملاحقة شركات النفط العالمية العاملة في العراق؟ طيب.
Well, first of all, I don't have exact figures for Misan, but I know in Basra between 2012 and 2024, something like 47 million acres of agricultural land were taken over by the oil companies and Iraqi oil companies and the internationals together for the purpose of oil extraction, and that when they take this land, which they basically forcibly remove people and take their land, even if they don't want to give it up. They give them very little compensation, if anything. Somebody told me that it's something like 900,000 Iraqi for 1 acre, something like this. So very, very low, like a few $100s basically. In terms of accountability, I think that this case against BP will be important. It will set a precedent.
إيش معنى ألف؟
Huh?
إيش معنى ألف؟
900,000. I think, if I remember correctly, بس مو كلش. But I have it somewhere if you want. Yes. What was I saying? Okay, but within Iraq, it's really difficult to hold these companies to account because, I mean, what I noticed is really the rule of law is very much lacking. In principle, the local environmental office has the authority to basically fine oil companies, for example, for pollution. But in practice, either the fines are too low and it's very easy for these companies that have lots of money to pay those fines, or when it comes to the governmental side, under Iraqi law, they can't fine the government oil companies. So those are just sort of subject to impunity. They can do what they want. And quite recently, someone in the local environmental office in Basra, the head actually, was arrested because they brought a case against an oil company in Iraq. Officially, the reasons were that he'd try to embezzle the company or blackmail them and get money off them. So it means that there aren't really any internal mechanisms that allow you to hold those companies to account. And when it comes to the land, someone told me in the from the agricultural sector in Basra that basically the sort of oil sector gets what it wants. So it could be any piece of land. If they want that land, they will get it, because at the end of the day, it's seen to be very important to the Iraqi economy, and nothing trumps that. So yeah, accountability mechanisms are really weak.
طيب هنا سؤال إلى عمر أو أنا أحاول عمر به عمر، هل ترى بأن ارتفاع درجات الحرارة بالعراق ارتفاع مفرط الحرارة، يعني نحن في خلال الصيف ترتفع الحرارة إلى أكثر من 50 درجة مئوية، هل ترى أن ارتفاع درجات الحرارة سوف يؤثر على الصحة العامة؟ بالتالي هل يمكن أن تنشط أوبئة غير مألوفة في العراق بسبب ارتفاع الحرارة المفرط؟
So basically, yeah, I mean, yeah, the simple answer, yes, especially given the kind of the degradation of the environment. I mean, you know, if you go to a place like Dubai or the Gulf states, the temperatures are actually even higher and the humidity is even worse. And sometimes, like I know some people who would actually say, "Oh my God, I'm going back to Baghdad because it's over there. It's much easier to deal with the heat than with the than in Dubai, for example." But the question here again is that the climate and the temperature are a kind of additive factor to this degraded environment, to the kind of collapse of infrastructure, lack of regulation. So yes, it's definitely will not going to be helpful. The kind of electricity cuts, for example, in these high temperatures, this is what kind of creates problems with food contamination. Salmonella in Iraq is actually the leading bacteria, and actually Salmonella is a drug right now in Iraq is one of the highest drug resistant bacteria in Iraq. So these are all problems that we'll begin to see more and more of. In global health, there is a term, we call it syndemic, a synergistic epidemic. So these are like two kind of problems that kind of coincide with each other, and they kind of complement each other, and they create more kind of an amplification of the effect of one problem over the other. So definitely the increase in heat, the demand, the higher demand on electricity, the failure to deal with a more of a sustainable environmental kind of situation will have adverse effects in the future in Iraq. I wanted also to kind of comment on an issue that I think many of us are kind of dealing with. I think Mac mentioned something about it. Taif also mentioned something about it, is this issue of environmental causality. This idea that we can kind of pinpoint one thing, that, you know, the cancer in the south is all because of the oil fields, or or because of the depleted uranium. This has become, I mean, this, if we look historically at this kind of science and advocacy literature, we see that, you know, the kind of the culprit of cancer, for example, has not only within Iraqis have been shifting, but also within these advocates who are like, you know, first they follow depleted uranium, then they kind of, so there is all these different shifting causal aspects. And to be honest, in scientific kind of frameworks, it is very difficult to create clear causality, because there are so many multiple aspects in the environment that could be triggering this problem. I'll give you an example. For the depleted uranium was, in the beginning of the 1990s, was actually attributed to be one of the main causes of the Gulf War syndrome, that many of the US soldiers returning from Iraq, they had all these different problems. And, you know, some of the people came out and said, this is depleted uranium. 20, 30 years later, we realized that this problem was actually created from the US bombing of the chemical weapon depot in the south of Iraq. And this became, like, you know, it required 30 years of research to make sure that there is a genetic biomarker that gets triggered by the sarin gas that eventually ended up in producing some of these problems. There is a problem of epigenetics, that also there's different triggers. People have different reactions to some of these issues. So this allows this murkiness, this production of ignorance, allows many of these private companies to get away with what they're doing. It allows accountability to be dismissed in many of these settings. So it is really like it's an uphill battle, and it is not really an easy one, but it is important to keep on. And I think kind of both all of us have been kind of all agree on this, that data and having baselines is the first thing that needs to happen in a place like Iraq.
شكرا جزيلا عمر. قبل أن نختم هنا سؤال سريع أتمنى علامات الإجابة عليه، وأيضا لدينا سؤال من نادية محمود، وسؤالي وسؤال نادية ربما يصب في نفس الاتجاه. بالتالي ما الذي يعوق الدولة العراقية من صياغة تشريعات تقود إلى حماية الصحة العامة من الملوثات النفطية؟ مثلا، هل تعطيل تشريع قانون النفط والغاز المعطل من العام 2008 لحد هذا اليوم يعوق إصدار تشريعات حمائية بيئية، وبالتالي عدم وجود قانون وطني ينظم استثمارات النفط والغاز هو يعوق بالنتيجة إصدار قوانين أو تشريعات حمائية. إضافة إلى هذا، هو أيضا يعوق مسألة فرض غرامات أو مسألة استحصال عائدات من الشركات باسم المنافع الاجتماعية، باعتبار الآن العقود النفطية الحالية تنص على يجب أن تدفع الشركات العالمية للحكومة العراقية أو للمجتمع المحلي ما قيمته 5 مليون دولار عن كل عقد، لكن في الحقيقة هذه الشركات لا تقوم بدفع هذه المنافع الاجتماعية، لأنها تقوم بمعظم المشاريع الصغيرة جدا لمصلحة المجتمعات القريبة من الحكومة النفطية، لكن من المجمل ليس لدينا قانون أو تشريع للحماية من الصناعة النفطية. نعم.
I mean, this might actually be a better question for Taif. What all I can say about is that you know I'm really not an expert in the legal frameworks around these things, but some of this boils down to a question of power. The Ministry of Environment is an extremely weak ministry. They, are in theory, as Taif was mentioning, in theory, the Ministry of Environment has the legal authority to write citations, to hold especially private actors accountable. There is this whole question about whether or not they can actually impose fines and repercussions on the Ministry of Oil. If you talk to different people at the Ministry of Environment, they'll give you different answers on their kind of legal jurisdiction in that regard. But in general, what you're seeing now is the Ministry of Environment is kind of aware of the fact that it's frankly become a bit of a, I don't want to say laughingstock because that would be a bit too strong, but they're aware that there's this kind of reputation that they have. And so they've worked hard over the last couple of years to try and sort of improve their relationship with the Ministry of Oil. But you don't see it in the context of real accountability. You don't see that there's a kind of actual, capacity for its for the ministry to hold the Ministry of Oil accountable. They do sort of joint initiatives, and there's kind of a sense of, okay, we're working together now, but not in the kind of sense that I think most advocates would like. But Taif, what are your thoughts on that?
Yeah, I agree. From what I understood, the Ministry of Environment actually has a good legal framework, and it's being updated. Like, I think there was a project to implement something to do with climate change, like to update the provisions basically to reflect the current environmental reality in Iraq. But I do agree, it's because the ministry is so weak, and two, because there's no rule of law in Iraq. Like, we can have good legal frameworks, but those frameworks are not implemented. And I mean, in Basra, there's even an environmental judge. Like, there's a whole legal infrastructure that on paper looks really good, but in practice, they can't hold anyone accountable, basically. Yes, and in relation to the social benefits that the oil companies are supposed to give, I mean, a lot of that money is just lost to corruption. And as you said, Safa, they end up buying school books for people. And while I understand it's supposed to be this compensatory mechanism for the kind of pollution created by these extractive industries, it seems to me that many of the things that these companies are supposed to be providing should actually be provided by the Iraqi government. Why are we going to a private company to build a hospital? That should be on the Iraqi government to provide those kinds of services for people. So I don't know, it's a gray area for me.
شكرا جزيلا طيب. فقط قبل أن نختم لدينا فقط 3 دقائق قبل أن نختم هذا الويبينار. إذا كان هناك أي تعليقات من قبل الجمهور يمكن إرسالها من أجل مناقشتها، وإلا بالإمكان إنهاء الويبينار. طبعا شكرا جزيلا للمتحدثين. إذا كان هناك أي أسئلة من قبل الجمهور. نعم، لدينا سؤال واحد فقط من عودة، هي تسأل لا أعلم من سوف يجيب عن هذا السؤال، بس ربما ما هو الأقرب للإجابة على هذا السؤال. هل هناك من أمل قريب من حصول أو جمع معلومات عن الواقع الصحي في العراق في المستقبل القريب؟ أي بمعنى هل هناك قدرة على إعداد قاعدة بيانات حقيقية ترصد القطاع الصحي في العراق؟
Specifically on the قطاع الصحي, like on the environmental, or sorry, on the health sector?
Yeah.
But I guess in what sense, you know, like what kind of data is the question?
يعني بمعنى أن نكون هناك لدينا قاعدة بيانات لمختلف الأمراض وانتشار هذه الأمراض جغرافيا وإلى آخره.
Okay, yeah. Look, I mean, yes, although I'll give you, there is data, you know, but it's often not shared or published in the kinds of ways that are accessible. So, you know, I was trying earlier this year to get some solid data on cholera distribution. And I called a friend of mine in the Ministry of Health, and literally whispering over the telephone, he gave me the numbers for a few different provinces because, you know, cholera and these kind of waterborne illnesses are really sensitive for the ministry. With cancer, the cancer registry is a bit more regularized, you could say, at least when it comes to the public health, or sorry, the public hospital reporting of data. But the more sensitive issue is around, you know, these questions of causality, these questions around access to care. And so it kind of depends on the disease. Where is, you know, what are the politics of each disease, and how do they kind of expose different vulnerabilities of the state? But in general, the access to data is fragmented, and oftentimes you can only get it through sort of contacts. So one of the things we're trying to do, Omar and I are working on a project, and there's a lot of civil society organizations that are also working in this regard, and frankly, doctors as well. It's not just, you know, organizations, to you know, to build sort of new and alternative databases. So some of this citizen science work is you know, intended to shed light on these kind of environmental health problems.
شكرا جزيلا لجميع متحدثينا مع الكابتن عمر الديوجي ضيف الحضري، وايضا شكرا جزيلا لكل من حضروا واستمعوا وشاهدوا شاهدوا هذه الندوه الافتراضيه، وايضا شكرا لمن حضر هذه الندوه عبر الفيسبوك. شكرا جزيلا للجميع، واتمنى ان نلقاكم قريبا في ندوه افتراضيه جديده. شكرا جزيلا.